Today I want to talk about something very serious. Serious to at least 8 million Americans a year that come down with what's called post-traumatic stress disorder, and at least a large percentage of our veterans who are being prescribed anti-anxiety medications which have not only been shown not to work for PTSD, but may actually make the situation far worse. All right, what this class of anti-anxiety medication is, so to say, is benzodiazepines. You may recognize them under the names as, like, for example, Xanax, Klonopin, Valium, or Ativan. But I want to get right into the research. And this is how this class of anti-anxiety medication, benzodiazepines, actually alters the brain to make PTSD far worse. Let's go right into the research. And this research is real recent. It's July of 2015. Here we go. In this public title called Benzodiazepines, not recommended for patients with PTSD or recent trauma. In the citation title, Benzodiazepines for PTSD, a systematic review and meta-analysis, the Journal of Psychiatric Practice, is July 2015. And this is what they go, and let's go right off into what the abstract says in the first paragraph. Because although benzodiazepines are prescribed to 30 to 74% of patients with post-traumatic stress disorder, 30 to 74%, that's a huge range. But regardless of that, the fact that they're even being prescribed to people with PTSD is disturbing. Let's move forward. There is little literature and no reviews before this article focusing exclusively on the use of benzodiazepines to prevent or treat PTSD. What the researchers did was this. The review identified 18 studies including more than 5,200 participants who survived one or more traumas, including physical injuries, life-threatening medical conditions, combat-related trauma, sexual trauma, and disasters. Now here we go to the highlight of that one paragraph here. It goes as follows. Based on evidence from these studies, benzodiazepines were associated with no improvement, and I proceed forward, in or worsening of overall severity. You heard that, making it worse. Psychotherapy outcomes, aggression, depression, and substance use in PTSD patients. And this is where they came down to too. The researchers are really concerned about what the VA has been doing to a lot of veterans with PTSD in generally the wholesale prescribing. They've gotten a little better over the years since 2010, but still, look at 27% of veterans at least still being prescribed benzodiazepines with PTSD, not recognizing the fact that there's no medical literature to support its use. In fact, it's even the opposite. It makes it worse. Yet, this cycle of abuse to our veterans is still continuing. Needless to say, the other 8 million Americans, so to say, who are also being prescribed benzodiazepines improperly. But let me move forward. It goes, with all the news stories today pertaining to the inadequate treatment and mistreatment of military veterans with PTSD, it is important that the healthcare community continues to analyze what we are doing. 12 studies provided data sufficient for meta-analysis. Meta-analysis is where they look at a bunch of different studies and put them all together. The results suggest that benzodiazepines were associated with no improvement in PTSD-related outcomes, and that using benzodiazepines in patients with recent trauma actually increased PTSD risk. Those studies providing sufficient data suggest that the risk of developing PTSD is 2 to 5 times higher in groups receiving benzodiazepines than in control groups. To reiterate, if you're taking a benzodiazepine for anxiety in regards to possibly developing post-traumatic stress disorder, your chances of basically developing full-blown PTSD are 2 to 5 times higher than a group that is not. Therefore, it makes it worse. You have to keep on looking at the numbers, looking at the facts, and what these guys did is look at the meta-analysis themselves. It said, quote, instead, they indiscriminately target the entire brain, including areas that are already hypoactive in PTSD. Hypoactive, not hyperactive. So hypoactive, this means the PTSD is causing certain parts of the brain to run at a lower level, suppress, sedate, so to say, or reduce function. And so when they take the benzodiazepines for the PTSD, it even makes it worse. It lowers the function even further. Proceed forward, such as cognitive and memory centers. So to reiterate, Instead, they indiscriminately target the entire brain, including areas that are already hypoactive in PTSD, such as the cognitive and memory centers. Because benzodiazepines have ongoing effects on memory, they may hinder patients from learning how to cope with PTSD symptoms. Evidence-based trauma-focused psychotherapies require the patient's experience and then master anxiety, they said. Benzodiazepines can impair that experience by numbing emotions, decreasing learning efficiency, and inhibiting inhibiting memory processing of material learned in therapy. So, basically what happens, the benzodiazepines are basically numbing the brain, per se, in an attempt to basically alleviate whatever we call anxiety. However, they are prolonging the PTSD. They may make the PTSD worse. In fact, the individuals taking the benzodiazepines or these anti-anxiety medications are forgetting or not learning the skills required to get past that PTSD. It's a problem a lot with the VA, where basically veterans or any other individuals are just being thrown drugs and not getting the proper treatment. It's easy to give people medication sometimes, way too easy. A medication does not mean, or should say not equate to being treated properly. So, to proceed forward, the report which revealed that 247,243 veterans from at least the Iraq and Afghanistan war have PTSD. So you're looking at these 27% of these veterans are being treated potentially improperly, even against the government's own recommendation. Now to proceed forward, there are ways to get off of benzodiazepines, but you can't panic and you cannot discontinue their use right off the bat, and it has to be done with a medical professional, because this is not a game. You're messing around with serious medications. But there's a good way of weaning off that that's been published by, I should say, the GPS Health Network. The citation title, not the citation title, the publication title is called Guidelines for Prescribing and Tapering Benzodiazepines in an Outpatient Setting. So what happens, you bring this to I'll put the link in there, the PDF file, or you go to the JPS Health Network yourself and see exactly how they discovered best to wean yourself off of benzodiazepines. Now you may be saying, well, I haven't been on them that long, so it's not a big deal, I can just go off of them. Now here, to read from the JPS Health Network's own site, this is what they say, and this is just how long it takes for benzodiazepines to mess you up. Here we go. Continuing benzodiazepines beyond 4 to 6 weeks will result in loss of effectiveness, the development of tolerance, dependence, and potential withdrawal symptoms and persistent adverse side effects. So if you've been on benzodiazepines between 4 to 6 weeks, you may need to talk to your medical professional about going on a withdrawal program. It's that serious. Just don't stop. That's messing around in an area which really needs someone to help and guide you through, just in case complications occur. So, to reiterate and recap, benzodiazepines are not recommended through multiple agencies, multiple psychiatric agencies, in regards to coping with PTSD. Again, I truly hope this helps. This is Ralph Turchiano signing off once again. Thank you.